Hi everyone, my name is Lori Geiselman. I'm one of the trainers in the Behavioral Health Certificate Program. This program is sponsored by the Rhode Island Department of Labor and Training, Real Jobs, Rhode Island, and developed by the Institute for Education and Healthcare at Rhode Island College. Let me tell you a little bit about myself. I am a clinical social worker. I am also employed in child welfare. I've been in child welfare for over 20 years. I also have the pleasure of working in healthcare like you at Rhode Island Hospital and Hasbro Children's Hospital as a clinical social worker. And so it's my great pleasure to meet some of you at some point and kind of talk about our shared interest in patients and healthcare and that sort of thing. But for now, I am here presenting a little bit of information that comes out of the professional behaviors and communication module. We're going to be focusing on active listening right now. I hope to cap this out at say 10 to 20 minutes, hopefully not too long. And at the end, you'll take a little quiz just to see how much you understand or how many more questions you might have. And that will inform what we spend our time on when we do get together in a Zoom classroom or in a person in face-to-face classroom, whichever occurs first. And in either case, I'm looking forward to it. So let's move on and talk about active listening. So professional communications and behaviors. They're, as you can see in this picture, there are a lot of different people, and we all have various ways of communicating, and we all interpret things a little differently. But there are some things that we can kind of generalize about and we have in common that are tips and tricks that we all can learn from, and those are what I'm going to share with you. It doesn't mean there aren't little nuances that we all know about or that differ from every other individual. This picture here I found online and saved it for this presentation because it's really shows some communication that's going on that does not involve the spoken word. I think it's always important for us to remember that there are primitive or primal ways of communicating, that we all know this language and we actually look for these signs and signals in each other, and it is just something that takes place subconsciously. We aren't thinking about it when we're looking at these cues that we give one another. Now, let's talk about active listening. And before we go on to say, oh, what can you do to make sure that someone else is listening, or that someone else thinks you're listening? I'm sorry, I messed that up. Think about yourself as the speaker, and how do you know when someone is listening to you? Some of the answers that you may give are the actual tips to remember when we're trying to be the listener. So what is the body language of the person who's listening? And how do you know when someone is not listening? That is just as powerful as what someone is doing when they're listening. Actually, I bolded that. It's probably more powerful. How would you know that they're interested in what you have to say? What are some of the things that they're doing? Are they making eye contact? Are they looking away? Or do they seem distracted? How would you know they understand what you had to say? How do you know they received your message? So what are some of the things that they might say to you, for instance, that would signal that? Now, here are some recommendations for active listening. You want to focus your attention on the subject being the speaker, and stop all non-relevant activities. What are these non-relevant activities? The little things that oftentimes we may find ourselves doing that would distract another person while they're speaking. One of my favorites, pet peeves, is the cell phone. When we're doing this, you ever have that person when you're talking to them and they're just moving like 100 miles a minute with their phone? and they're doing this. Yep, I'm listening to you. And you want to say what? No, you're not. One of these days, you're just going to say, tell me what I just said, and see how much of it they can repeat back to you. Avoid distractions. A distraction might be a window when there's a lot going on outside, or there's a lot of noise outdoors, maybe some road work and that sort of thing. A talkative neighbor, that could be the person in the cube next door. I'm not necessarily talking about a person who lives next door to you at your house. Seat yourself appropriately close to the speaker. In this environment where we're all practicing social distancing and we have barriers, plastic barriers set up, and we're all wearing face coverings of certain types, it can be a little bit challenging. For us, we're lucky in the healthcare setting in that because of the reason we've come together, we're both wearing masks, and we are still managing to sit a little closer than, say, how close you would stand to someone in the supermarket line. It's a little different. We want to acknowledge any emotional state. When a person comes in, if we are perceiving that they're very upset, for instance, we might stop and say, oh, I'm so sorry, I see that you're really upset. Tell me how I can help. Or let's see what we can do about this. You're not making any promises other than letting them know that you're interested in hearing more, you want to know what their complaint is, and that you are ready to take action if it's in your control, right? So that's all you've signaled. But that is going to do a lot to help to de-escalate the situation. Set aside your prejudice and your opinions. We oftentimes, based on a little snapshot of what we see in a minute, are ready with our opinions on what is going on with that person. The problem with that is we're almost always wrong. It's very important, if we care about accuracy, and we all like to be right, if you stop and let the person tell their story and tell you what's going on, you're most assuredly going to be correct, because it's going to come straight from that person. They are equipped more than anyone to give you the truth in what's going on with them. Be other directed. So be directed towards that person, not on yourself, not in your own head. An example of this would be, do not have prepared in your head what you're going to say to that person when their lips stop moving. That is being self-directed. So you want to be careful and be focusing on that person who is communicating, and not be preparing your speech for when they end their talk. Because if you know exactly what you're going to say, you're spending way too much time thinking and not listening. Focus and understand the speaker as if you were walking in their shoes. This is a great way to form some empathy around what's going on, but you have to stay in the moment. If you are moving forward, meaning you're jumping 2 steps ahead and you're predicting what they're about to say, and you're spending energy and thinking time on that, or you're going back and you get stuck on something that they said 2 minutes ago, then you're not in the moment, and you're not understanding them in that moment in time. Be aware, listen with your ears, but also with your eyes and other senses. Like no other time. If nothing else, we are all becoming very gifted in reading each other's eyes, because, right? That's all you can see behind these masks. And I think we're all learning when people are smiling or not smiling behind these things. And or what else is going on, and how do we tell? We're being forced to look at more body language. Not a bad thing. Let the argument or presentation run its course and don't interrupt. It's a tough thing to do. A really quick story, I did a class with a group on motivational interviewing, and one of the exercises was I set a timer for 2 minutes and asked people not to talk for 2 minutes and just listen, it was very hard. It was hard to be the listener and it was hard to be the talker because we are not good or used to having someone listen to us for any length of time without interruption. So it is actually a skill on both sides of the fence. Try it out one time. Just incidentally, when I ran the exercise a next time, I only did it for 1 minute because people were completely unable. I swear, after about a minute, all of a sudden I heard a lot of chitter chatter and I'm like, why are you guys talking back and forth? You're supposed to be listening. They're like, we can't. So it isn't easy and it takes some time and practice, but I think together we'll all get better at this. You want to be involved, actively respond to questions and directions. When someone is interrupting their own story to ask you a question, that is no time to be like, nope, I'm just listening right now. You want to answer their question and show them that you're engaged and that you are willing to provide some answers or information that they may be asking you. And use your body position and your language to put them at ease and also to continue to encourage them and signal that you're interested in what they're saying. Nonverbal communication, this is a little bit of a repeat. They're talking about body movements. So this goes both ways. Not only what we are sending to the speaker, we're kind of signaling and talking to them at the same time with our body while they're trying to talk to us verbally. Hand gestures, nodding, shaking our head. So if I happen to be doing this while you're talking to me, you're probably going to think, oh, she's listening and she's going, I got it, I hear you, I'm listening, that kind of thing. Oftentimes that's what that means. And we can talk in class a little bit about if it means something else to you specifically. If that person is doing this to us or they're doing a lot of hand gestures, what does that mean? It may be nothing except that they're big hand talkers. Posture, how we are sitting or standing, or how about them? They're all slumped over and they're looking down at the ground, or they've got their arms all crossed, or we've got ours crossed. There's a little bit of miscommunication with the crossed arms. A lot of the literature said it means you're closed off and you're not listening, and that's what we're signaling to one another. I have a lot of people that will say otherwise and say, no, I'm just resting it's how I rest. I like to do this. So, we got to be careful not to read too much into it, but we don't want to be the person that's sending the message that I'm closed off and not listening to. So if we are arm crossers, we want to make sure that we're looking relaxed. Maybe our hands are in our lap, where our arms are at our side, and we're paying attention and not doing a whole lot of other things with our bodies. Eye contact. This is, again, a little bit of a controversial thing because based on whatever your culture is, eye contact is not necessarily something that is considered a practice that everyone participates in. For the most part, we think that when people make eye contact with us, it signals a higher level of trust, and it acknowledges listening and that I'm actually hearing what you're saying because I'm looking at you. Again, when we talk about culture, which is at one of the, our last module, we will kind of discuss some of this eye contact information. But in general, if a person is making good eye contact with you and you with them, it normally would mean some sort of trust. But not always. If we're looking at it through a cultural lens, we just want to be mindful and careful of that. So some more nonverbal communication. Physiological changes. When a person is really nervous, they might be blinking a lot or sweating. And there might be some other things that you could put there. Maybe a person is standing up and they're pacing. And they're talking to us at the same time, but that pacing is going to tell us, hey, they're a little keyed up right now, or they're nervous, or they're upset, and that sort of thing. And how can we get them to kind of sit down? Maybe what we do is, if they're pacing back and forth, we would go sit down and say, or go get a drink of water and say, here, let me put some water down on the table next to a chair and say, hey, sit down and have some water with me, or something like that. I mean, there are things that you can do. And again, we'll get to talk more about that. Closeness or personal space. People have different comfort levels with this, so we want to be careful. I don't think anybody wants you to stand more than 6 feet closer to them right now. However, generally speaking, there are certain levels. Most of us like at least a good arm lengths away. And there's some interesting science behind what, people's comfort ranges are. You'd be surprised. It's actually generally thought that people like more distance. If you're sort of a touchy-feely type person as I can probably tolerate a closer proximity than a typical person. So for me as the listener, I have to be careful and not get too close to that other person because I have, or because I require less space. I hope that makes sense, what I just said. Other language or aspects of our voice apart from speech, such as our pitch. Are we screechy? Do we sound distressed? Our tone or our speed of speaking? Do we sound subdued, depressed? That is something that we want to be able to pick up in someone else who is talking to us, and we will pay attention to those kind of things. Is their speech kind of pressured, like I'm really mad kind of thing? Facial expressions tell us a lot. We want to be looking at people while they're speaking with us. Are they smiling while they're telling their story? Are they frowning? Do they get a tear in their eye? Are they blinking a lot? Again, remember, blinking might signal some nervousness. And then what faces are we making? We want to be careful not to show shock in our face as they tell us, maybe something very difficult that they just experienced, and all of a sudden we may show them a look of shock that might signal to them, oh, I shouldn't have told them that. I'm not going to say any more about it because they were really shocked, so they're not equipped to handle this information. So again, you want to be careful what kind of reaction we're giving to anything that they say to us. And then there are also verbal signs that we will give that show attention, that we have been actively listening. Positive reinforcement. Wow, after all that you've been through, you managed to do A, B, or C. You're giving them that positive reinforcement that I learned, that I listened to everything that they've been through, and this achievement that they've made. Maybe the achievement is that you've come in today to get some help for your family member or for yourself or whatever the situation is. Remembering. You remember something they said in the beginning of the conversation and you weave it into your response to them. Maybe you remember the name of one of their children, or you remember an experience that they shared happened to them a while ago, and that you're remembering pieces and parts of the story that you had to have been listening to remember that. Questioning. So we ask more, we want more detail. We ask an open-ended question that requires more than a yes or no answer. And that is going to also tell them that, wow, not only did I hear everything that you said, but I'm seeking more details so that I can better understand and help you. Reflection is basically saying back what someone said to you to make sure that you got it right. And they will tell you, no, that's not what I said. I said this, and then you try it again. Clarification, that would be where you're looking for to make sure that you got a certain part right. So you're not going to repeat back the whole thing, but you want to clarify a meaning perhaps. And summarization isn't overstated when I say it's really important. It's often a segue into like our next steps conversation as a patient is getting ready to leave or when we're finished. So summarizing most of what the patient talked to you about, like what were the main themes, and if there were any action steps that they talked about or any needs they talked about. So Ms. Smith, you told me about this experience and you're hoping that I can help you with A, B, or C. Is that correct? And then you go on to, well, you know, here's what we can try next. And so now you're planning. You're going beyond what they came in for. And of course, that's stuff we'll talk about later. That's the gist of active listening. Coming up, we're going to talk more about active listening, and you're going to have a chance to apply what you learned through exercises and some group discussion. And so wherever there's a lack of clarity, see, I'm bringing some stuff back, you'll have a chance to bring that to class with you. When you take the quiz at the end, that will also signal where maybe I wasn't clear about something or you had more questions. And so that will mean that myself or a colleague will spend a little more time in that area if there was some confusion around a certain piece of this information. Okay, and last but not least, I thank you so much for listening to me, and I hope to see some of you soon, and be safe and well out there, and congratulations on being part of the program, and looking forward to continuing on with you. I think I have a couple more modules that you will be seeing from me in the future too. Bye-bye now.